Hello and welcome to Shopping East Tennessee on WTMB. Joe Palo with you today at First Health Clinic, located in the Ocoee Crossing Shopping Center, Bilo Shopping Center, right here next to Logan's, of course, Chick-fil-A. You know where we are. Beautiful place inside here and a great place to take care of all of your health care needs. I'm here with Cheryl Jaggers, who's the lovely wife of very prominent physician here in town. Everybody knows Dr. John Jaggers. And Cheryl, of course, is part of First Health Clinic. And yes, they will take care of all of your health care needs. If you're ill, they'll make you better. If you feel bad, they'll make you feel better. But today we're here for a little different reason. Cheryl, along with Leanne Love, has developed a medical clinical diet plan called Clinical Solutions. And what this plan is an opportunity for you to look and feel better, to lose a lot of weight in a short amount of time, medically supervised. So you're not on your own and doing your own thing. These folks are here for you and they're cheerleaders for you. In fact, I'm starting the program tomorrow. So within a matter of 28 days, there's going to be an improvement, if there needs to be any, to this Adonis body that I already have. It's going to be just that much better. And so I'm going to look good, I'm going to feel good, and of course you're going to come along for the ride with me, and we're going to let you know today how you can be a part of this as well. First of all, Cheryl, thank you for being with us today and having us out here today.
Thank you for coming. We welcome y'all to be here, and we can't wait to see less of you.
Well, I'm hoping that starts immediately. Of course, as I said, tomorrow I start the program, and for the past 2 days, you have had me doing, I like to use the phrase power feeding. It's basically eating as much as I possibly can, at least 3,000 calories for 2 days before you start the plan. Well, you tell us the reason and then tell us how the plan works.
Okay. Originally, we designed the diet, and it's a weight management program, and hopefully it's the last diet you'll ever have to go on. We can do this and then transition you to something to maintain your weight loss. And we studied that 30 days is the optimum amount of days to put someone on HCG and allow them to lose the amount of weight. But actually, it's 2 days of pigging out and loading while your body's getting revved up and getting the therapeutic levels of HCG in the system. Mm-hmm. And then you go on day 3 through 30 to a reduced calorie, 3-meal, 2-snack plan that allows you to reverse the fat burning process. Normally, when you go on a reduced calorie program to a very restricted diet, what happens is you lose lean muscle, your normal fat and your structural fat, which pads the organs and absorbs the vitamins A, D, E, and K. HCG reverses the fat burning process. So where on day 3, all of a sudden you're not taking as many calories in here, your body is signaled to start burning your famine fat through the HCG process, and you start losing the stubborn belly fat, and you burn your famine fat for your nutritional and vitamin stored needs. And the 2 days of loading actually helps satisfy your structural and your normal fat needs throughout the next 28 days, where you're going to go to a reduced calorie program. Okay. And so you feel good, you sleep good, you have increased energy, and we're going to help you get through this 28 days and make it a 28-day game with yourself. Make it fun.
Well, I think the thing about it that's exciting, it's a lifestyle change, and I know this is lifestyle related, so this is a way for someone to come in, lose the weight they need to lose, and then keep it off through a series of just a maintenance program that I guess you would go on anyway, considering the fact that at the end of the 28 days, your stomach shrinks to the point where it doesn't take as much food to fill you up as it did a month before.
Absolutely. After the program is completed in 30 days, we monitor you for 3 weeks, which is 21 days, and the HCG actually has a washout period. And if you happen to lose a little bit, or want to lose a little bit more, you can go back on it. However, in the 21 days, we do something that's called a phase 2 plan, where we teach you, we actually have the monitors, the fit monitors, the health fit monitors that the Biggest Loser has, and it will give you what your set point is, and yours may be 2,019 calories that you need to maintain your weight loss. But we teach you how to do it in carbohydrate control, okay, as well as something that's called ideal protein. How much protein do you need? And we try to balance your carbohydrates with your proteins, and that way you get optimum metabolic function of your system. And a lot of times by then we've taken patients off of their hypertension medications. We also work with their primary care if they're under primary care for hypertension and diabetes, oftentimes they're off their diabetes medications significantly and hypertension medications as well. So we're trying to ward off some cardiovascular disease and correct metabolic syndromes and these polymetabolic syndromes, or syndrome X as they describe it. And that's our goal.
Well, I think what we need to let folks know is that First Health Clinic here, of course, it's family medicine. It's immediate care. Appointments are given, but walk-ins are welcome. Hypertension managing is what you said.
We do manage some people acutely as well as chronically. So if someone already has a primary care physician that's following them, usually if we see them just out of an immediate need, whether it just be just a quick strep or something like that, and they haven't been able to get another office, we send them a note and copy them on a note and let them know they've seen us as well. So we do both.
And then diabetes management as well, I think you do here.
We actually are managing some of the folks in diabetes management. That was our training. All of us here are adult cardiovascular or family nurse practitioners and trained under physicians, and that was a part of our curriculum in school. Right. So we actually do diabetes management, but if they've already, again, I want to stress, if they've already got someone that's managing it, we collaborate with them and make sure that they understand what the patient is going through, and they're copied on the notes as well.
Well, I said all that to let you all know that they are very well qualified in seeing you through this clinical solutions program and the process that you'll experience through it. Now, let's talk about this. It's based on a diet, but it's also based on the HGC that you're talking about.
Correct.
So the HGC, HCG, I got to get it right. The HCG kind of boost your metabolism maybe to move a little faster, and then of course the food that you're eating is less, so it all works hand in hand.
The way it works is, and actually the actual manuscript in our program is, which we studied for a year before we ever implemented it, is based on Dr. Simeon's notes from the 1950s.
Okay.
And back in the 1950s, Dr. Simeon went to India, and he watched these women in India that had hardly any nutritional stores or fat to draw from birth these healthy 5, 6, 7 pound babies. And he ended up staying in India 18 years and studying the placentas and studying human chorionic gonadotropin and the effect on the body when someone becomes pregnant. And what he realized was, if you have HCG in your system, basically if you go to a reduced calorie diet, within the weight management program, the HCG system triggers your body to burn abdominal fat or famine fat, or your abnormal fat stores for its nutritional needs. You can't do a reduced calorie program like this unless the HCG is the component.
Okay.
And we targeted where we wanted our HCG to come from, and this is what's so huge because so many people are getting on the HCG bandwagon. The HCG that you're getting is being ordered and compounded through a pharmacy in town that orders it from a particular lab that we ask it to come from. So it's pure. We have certificates of authenticity and potency. It's not another Me Too program that it could be homeopathic or it could be synthetic. It is pure HCG. It will turn a pregnancy test positive very rapidly.
So if I take a pregnancy test, it'll show that it's positive?
Now, actually, if you take a pregnancy test, it will not show positive in you. So, no. We don't have to worry about that. But prior to your injection, it actually will. But it's pure HCG, okay? That actually is.
Well, what does HCG stand for? And I know HGH, but what does HCG stand for?
It is human chorionic gonadotropin. And so it's actually what's in the blood, and it's actually in the urine that actually does turn a pregnancy test positive. Okay. But it's the hormone that basically resets, it stimulates the diencephalon in the hypothalamus to block the satiety center so you're full, but also it raises endorphins, you'll sleep great, but also it reverses the fat burning process. It tricks your body basically into thinking that you're pregnant, but you're not. So but into doing so, if you are taking less in here, it goes, whoa, I need to activate some of these reserve nutritional stores, and it actually uses the outer layer, your famine fat, your abnormal fat that you want to lose on this program, not your structural fat, your normal fat, and your lean muscle. So you preserve the lean muscle, and we teach you how to get enough protein in where, again, protein helps satisfy the hunger and the cravings as well as other foods that we show you. But it's 3 meals and 2 snacks with limited carbohydrates, and it's 28 days, and if someone wants to go back on it, they can after a 3-week washout period. But a lot of people go on to lose weight during the 3-week maintenance phase initially, and it's individual. We're going to work with you until
I lose all the weight I want to lose.
Exactly.
Now, the amazing thing is, if you come in this clinic, a lot of the ladies that work in here have been on the program. You were on the program.
I was.
And there's a lady here, a consultant, that has lost 63 pounds on this program. Now, what I guess I want to ask, the HCG is obviously a woman's hormone. Is this safe? I guess it is because I'm doing it, but is it safe for a man to do this?
Yes, actually men do very well, as they always do in weight management programs, because men have more muscle. And so, as you know, muscle burns more fat than fat, and women tend to have less muscle. So men do tremendously. I mean, their weight loss a lot of times is exponentially greater than women, just because of the nature of their structure. But yes, and I'm going to tell you, hopefully it'll be the last weight management program you go on, and we can stabilize you and keep you the way you want to be. But you've got to want it, okay? I'm not going to tell you that the program's exactly going to be easy, okay? You've got to exercise a little mental toughness, but you can see 28 days. That's where in programs that just go on and on and on, you actually have the opportunity to expedite weight loss, and it's only through HCG.
Right.
The HCG allows you to burn the fat that you want to go away, and quickly and rapidly. And that's why we keep you coming and seeing you weekly, and we do follow up after that. But we also teach you how to maintain the weight loss.
And it's monitored. You folks monitor the patient, so you know exactly where they are at every point of the diet. I think the thing that really struck me too is, Cheryl just mentioned it. You exercise your psyche, but that's about it. So on this program, you don't necessarily have to exercise to lose the weight. I know some programs, they recommend you exercise a little bit along with it, and that kind of helps boost your weight loss a little bit. But this happens as long as you eat the food that is listed in the diet, the way it's listed, you take the HCG, get that right, you're going to lose the weight without having to go do like the Biggest Loser and run around.
Right. I don't want you to exercise. I don't want you, because that's going to, actually that will help. You'll experience more hunger if you exercise.
Okay.
So if you're not already exercising, I don't want you to start exercising.
I guess I better stop.
So the reality is, so many patients start losing weight and they get 10, 18 pounds off, and I say start walking the Greenway. It's beautiful.
Right.
Walk it before it gets so hot. And but I don't ask that you do all of a sudden start exercising. A lot of times I can tell if someone has exercised, because a lot of times they'll come back in and they'll either be really, really hungry and they'll confess that they've started exercising really hard, and I'm like, just walk the Greenway. Or sometimes it can cause them to retain fluids, and they'll actually have a small hiccup and gain weight.
Right. Well, see, the thing is I'm not going to have the hiccup. I'm not going to gain weight. I'm going to lose weight. And you folks are going to take the ride with me. So every Monday night during the East Tennessee Shopper Show, which is a live show on WTMB Channel 5 from 7 to 8 o'clock, you tune in. You're going to see my progress. I'm going to lose weight. I'm going to feel better. It's going to help me to sleep better and have a little bit more energy. And so it's a program you're going to want to obviously look at and then consider it for yourself, because if you're interested in losing weight, this could possibly or probably be the last diet you will ever have to do. And you just come see Cheryl Jaggers or any of the fine staff here at First Health Clinic, and they will set you up. I appreciate you being with us today, and I look forward to this program working, and I look forward to letting everybody know how well it's worked throughout the period. It's a 28-day program that at the end of 28 days, I'm going to be so transparent, you won't even see me anymore. The bad thing, I told Cheryl, and she says women love that as a problem, is I'm going to have to buy new clothes. But that's a good thing, I guess.
That is a good thing. Absolutely. It'll stimulate the economy.
Good deal. Well, Cheryl, thank you for being with us, and wish me luck, folks. And it's going to work, and it'll work for you too. Again, First Health Clinic, which is located in the Ocoee Crossing Shopping Center, Bilo Shopping Center, right here off Keith Street. Phone number is 472-4677. Give them a call and check out what they have here, Clinical Solutions. For Shopping East Tennessee on WTMB, I'm Joe Palo.